All right, so we're going to talk about some common infant health concerns. We're not really getting into infant illness. We'll talk about serious illnesses when we move through the different systems in pediatrics. But colic is a common infant health issue. It happens with 15 to 40% of all infants. What happens is usually around the same time of day, every day for several hours, the baby appears to be in pain and cries. Colic is defined as crying for 3 hours per day, more than 3 days per week for more than 3 weeks, and without an identifiable medical reason. That means this baby that's diagnosed with colic has to be gaining weight and thriving. If they're not, or if there's an identifiable reason for the pain and crying, then it's not colic, it's whatever that is, okay? Some theories: some babies feed very rapidly, and so they may be swallowing a lot of air, or they may be overfeeding. Sometimes they may not be burping well. Some babies are just hard burpers. It's hard to get them to bring air up. Sometimes positioning can put more pressure on the GI tract. There's a theory that maybe emotional stress, either theirs or the people around them, may be a factor. Some babies have difficulty regulating their sleep-wake cycle, so it may be a baby that's just really tired and can't go to sleep. Sensitive or high-strung temperament babies are more likely to be colicky. Parental smoking is a factor. It is known to increase the risk, but it's not the only factor, because clearly there are babies whose families don't smoke who have colic, and babies whose families smoke that don't. Lactose intolerance is one theory. Difficult parent-infant interaction, when the parent's communication with the baby is just not quite meshing. Some babies are overstimulated. Central nervous system immaturity. One that's not supported by research is reflux. A lot of families assume that colic is due to reflux, and that's not really supported by research. Okay, colic management. Because no one knows what causes it, it's kind of a shotgun attempt. What are we going to do about it? So if they suspect cow's milk allergy, they might try changing the child to a hydrolyzed formula. Sometimes that helps. Lactobacillus acidophilus showed benefit in one study. The biggest thing is support the parents, because the parents are exhausted, they're stressed. So lots of support, encouraging them to take turns, to find relief, and to put the baby down and walk away if they're just really, really very stressed. But the goal is to try to find and eliminate anything that might be contributing. Warmth and gentle pressure on the abdomen can be helpful. So that colic carry where they're draped over your forearm and you walk and rock them can help. Massaging the abdomen, putting the baby in a front carrier or a sling, swaddling them may help. Some families try bottles that minimize air swallowing. Smaller, more frequent feedings. We really want to encourage parents that if they're getting just overwhelmed, to try to put the baby down and walk away for a bit. Put the baby in a safe place in the crib or something like that, and walk away to take a few breaths. Colic usually resolves spontaneously around 3 to 4 months. Failure to thrive is another not uncommon problem with infants. It is inadequate growth. If a baby's not growing, one of 3 things is happening. They're not getting enough in, they're not absorbing what they take in, or they're expending too much energy. They're using up more than they take in. So inadequate intake can be a problem of feeding. The parents are not feeding the baby enough. It can happen with breastfeeding. If they are trying to breastfeed and don't have adequate milk supply, or if they're trying to breastfeed on too strict a schedule, that can affect milk supply and intake. It can happen with bottle feeding. Sometimes parents that don't really know how to get the baby to eat may feed an ounce or so, and then instead of burping the baby and feeding more, they may just put them down to sleep. So sometimes it's knowledge, sometimes it's willful not feeding. But it can also be a baby that just has a hard time getting enough in because they have an uncoordinated suck and swallow. If they're taking enough in, they may not absorb it. So they can have absorption problems because of food allergies or intolerances. or because of some disease processes. And the other is they may be expending more energy than they're taking in. And that's common in preemies. And we talked about that in the setting of preemies, but it can happen with some other disease processes also. The treatment for failure to thrive is to find and treat the cause. Why is that baby not getting enough calories in to support them? Positional plagiocephaly is another not uncommon problem in infancy. It's when the baby spends too much time on one side of the head and it flattens. Most commonly, you might see the back of the head. With preemies, sometimes we'll see the sides because of the way they're positioned in the NICU. When the Back to Sleep campaign began, we saw a big increase in this because the babies were put down to sleep in their crib. And then during the day, they might be put in a car seat or infant seat with a firm back. And so it caused the skull molded to that position. Prevention, alternate head position that helps keep a flat spot from one side, but also use prone positioning when awake. We want to put the babies aren't supposed to sleep in their tummies anymore because of the risk of SIDS, but we can put them on their tummies some of the day or upright being carried, things like that, to help give their heads more time away from being against a flat surface. Management, sometimes this happens because of torticollis. There's a tightening of the muscles, and so the head only turns one way. So, or sometimes it happens together. They've always laid on the one side, and so they've got a flat spot and tight muscles. It would be over here. And so PT may be needed for that. Helmets are used. It's a soft helmet that's used to decrease the pressure and allow the head to reshape. Screen time for babies before 18 months, it's not recommended except for FaceTime with family, etc. All right, next we're going to talk about how to adjust nursing care for an infant.